I went in for a regular mammogram, and then they said they wanted to do a biopsy, and I did the biopsy, and it came back as ductal carcinoma. That was January 10th. I was diagnosed. I had surgery on June 20th, and I had a double mastectomy with a deep flap reconstruction. And a couple weeks after surgery, I got a post-op infection, and I was back in the hospital on IV antibiotics. Went back and saw Dr. Hassanin, who was my plastic surgeon, and he referred me to the wound clinic. That's when Matt started taking care of me. He was just great. I had a pretty significant wound, and he talked to me about nutrition. I was pretty malnourished when I got here.
So when Julie first came to us, what I remember from that first visit, what really stuck out in my mind was we were doing the wound care. It was a large, dramatic wound, and we were working with that, getting a plan for that. So I asked her just kind of offhand, so how's your appetite? How are you eating? And she said, well, I've eaten a banana today. And when you have a large, complicated wound that's draining a lot, you need a lot of protein. The guidelines are to basically just about double the amount of protein you eat in the course of a normal day. Gave her some coaching on that, just the different things she needed to eat, big focus on protein, and she really took it to heart. And we saw the difference on the second visit. She was already healing pretty well.
I was surprised when he told me I was malnourished, because those words have a certain impact. I just knew that I wasn't eating. So I was really surprised when he told me that nutrition was like 90% of the healing process for wounds. I've had the best care here. When Matt hasn't been here and I've seen the couple of the other therapists, they've been great. They all take copious notes. They know exactly what's going on with me before I walk in the room. They know where I came from and how bad it was when I started. Their guidance has been just instrumental in me getting better.
I think it's a collective contribution of the commitment of our clinical healthcare providers. They do the best really they know. And again, as part of the central leadership, it is our job to keep them updated of novel solutions and how to circumvent barriers. They encounter barriers all the time. Patients that have non-healing wounds have many other underlying complications, and they're otherwise very stressed out and challenged in many ways. When we see that this part of their complication that we have been able to solve, that smile on their face when they walk back home, that is the biggest payback we can have.